A higher percentage of COVID-19 cases from the new BA.2 variant. Alex Littlehales explores what to expect in the event of another spike in cases.
Virginia's surges and falls between high and low COVID cases aren't over yet. The state's health leaders say we're only transitioning from a COVID pandemic to an endemic.
Endemic, or where rates are kind of static over time.
3 weeks ago, we reported how fast the BA.2 subvariant of Omicron was spreading. In late March, the variant accounted for 20% of cases in the Commonwealth. Today, on April 11th, research from the Centers for Disease Control estimates it's now almost 70% of the state's new cases. Dr. Lisa Thengen with the Virginia Department of Health says our immunity from vaccinations and previous infections could lessen over time.
Immunity can start to wear away, and especially when you introduce new variants, that protection could be even lower.
Cases are low in the Commonwealth, but VDH and CDC research concludes a minor surge is still possible. According to VDH modeling, one forecast for a BA.2 variant surge predicts cases could reach 20,000 per week in June, with a peak sometime in July. Dr. Thengen says part of the unpredictability of what's next comes from the variant's higher transmissibility, which VDH research assumed to be 30% more infectious than the last Omicron variant this winter. The Department of Health expects this new variant to account for almost all of the new cases in Virginia in just a couple weeks, and for case rates to perhaps double by May. In Norfolk, I'm Alex Littlehales for 13 News Now.
There are only 3 health districts in the entire state that are not seeing declining or plateauing case rates.
All right, let's check out today's COVID case numbers in Virginia and North Carolina. The Commonwealth reported 480 new infections. Since the pandemic started, there have been more than 1 million or 1.6 million total cases. And the Tar Heels state only updates numbers once a week. And last Monday, there were 416 cases reported. There have been more than 2.6 million cases. If you test positive or have symptoms, the CDC says you should isolate for at least 5 days, regardless of vaccination status. As far as treatment, the FDA has approved one medication, remdesivir. It's given to patients in the hospital. The FDA also has authorized a pill called Paxlovid. That's to treat milder cases in people who are at high risk of hospitalization and death. If you test positive in an at-home test, schedule a PCR test as soon as possible. That way you can confirm you have the virus and the results will get reported to the state.